Today, we'll be talking about absence seizures, a condition that affects many children and can often be mistaken for daydreaming. Absence seizures are a neurological condition caused by abnormal electrical impulses in the brain. These seizures involve brief and sudden lapses of consciousness and can often be mistaken for daydreaming, especially in children. Absence seizures, also known as Petit seizures, are characterized by brief episodes of staring into space, fluttering eyelids, and sudden pauses in movement. They are more common in children between the ages of 4 and 14 and tend to affect girls more frequently than boys. Typical absence seizures, sudden onset and end, last for 10 to 30 seconds, often triggered by hyperventilation. Atypical absence seizures, gradual onset and cessation, last for several minutes, may include additional symptoms like eye blinking and hand movements. Common symptoms include staring blankly into space, sudden pause in movement, fluttering eyelids, lip smacking or chewing motions, cognitive challenges such as difficulty concentrating and stopping speech abruptly. Absence seizures occur due to abnormal brain activity and may be influenced by several factors. Genetic factors play a role, as a family history of epilepsy increases the risk. Neurotransmitter imbalances, which are disruptions in brain chemicals affecting nerve communication, can also contribute. Additionally, age and gender are factors, with these seizures being more common in children and girls. Early diagnosis is essential for effective treatment. Common diagnostic methods include an electroencephalogram or EEG, which detects abnormal brain activity using electrodes placed on the scalp. Magnetic resonance imaging, or MRI, helps rule out other neurological conditions like tumors or stroke. Absence seizures can be managed effectively with medication and lifestyle changes. Treatment options include medication, such as anticonvulsant drugs like ethosuximide and valproic acid. Lifestyle adjustments are also important, including adequate sleep stress management and a healthy diet. If left untreated, absence seizures can lead to several complications. These include learning difficulties, social withdrawal and isolation, an increased risk of generalized convulsions, and long-term medication dependency. When it comes to dietary recommendations, there are certain foods to consider. Foods to eat include high-fat, low-carbohydrate ketogenic diets. On the other hand, it's best to avoid processed sugars, artificial sweeteners, monosodium glutamate or MSG, and synthetic food colors. Let's address some frequently asked questions. 1. What should I do if I think my child has absence seizures? Seek medical advice promptly and request an EEG test to confirm the condition. 2. Do absence seizures cause brain damage? Generally, absence seizures do not cause brain damage, but frequent episodes may affect cognitive development. 3. Can absence seizures be cured? Many children outgrow the condition, but medication may be needed for some individuals long-term. 4. How long does the treatment last? Treatment duration varies. Some children may require medication for a few years, while others may need lifelong management. And 5. Is absence seizure a progressive condition? Absence seizures are not usually progressive, but they require ongoing monitoring to prevent complications. Disclaimer: this content is for educational purposes only. Please consult a medical professional for diagnosis and treatment. At Serenity, we always share well-researched and valuable information to ensure you stay informed with accurate insights.